Hello, we have a few more folks coming in. The numbers are ticking up, which I love to see. All right, we're so glad you're here. We're going to start this presentation pretty soon. My name is Hannah with America Walks, and I'm just here to do some housekeeping up front. There are two ways that we'll be communicating. Well, there's technically three ways we'll be communicating during this webinar. One is through the presentation, the other is through the questions, and the third is through the chat. So with the questions, you can ask a question directly of us. Myself and my colleague Kate will be behind the scenes answering questions and trying to collect data points and making sure that you have all the supplemental material you need. In the chat, I will be posting links to things that Dr. Frank is talking about. So if you are curious about where something comes from, we're going to try and keep up with that in the chat. This webinar is being recorded. It will be on YouTube once we're done. So you can see it there. You can see all of our past webinars there, and we'll be recapping it in an email and in a blog post afterwards. So there will be even more links, video of it, quotes from the transcript. So a lot of that stuff is going to be available afterwards. So just to get ahead of any questions about that kind of thing. I think that's it from me. So I'm going to turn over to Mike, our Executive Director at America Walks, and let him introduce our guest and get us started.
Thank you, Hannah. So first of all, everyone, welcome to this America Walks webinar. I really need to start by giving a big thank you to the Centers of Disease Control, which funds through their Active People, Healthy Nation program, these educational efforts. And this one really hits exactly why they support us. One of the reasons America Walks is supported by them is because we support activity-friendly routes to everyday destinations because of the health benefits, the considerable health benefits of being able to incorporate walking or physical activity, other physical activity into your everyday life. And our guest today is Lawrence Frank. He's a professor at the University of California, San Diego. He's the president of Urban Design for Health. And beyond that, he's somebody who really knows the connection between land uses, street design, and walkability. I learned about his work. I was living in my neighborhood in Seattle. I was not yet a mayor. I was a community council person. And I came across the study called LUTAC, Land Use, Transportation, Air Quality, and Health, that was done in King County. So this would have been around the year 2000 or so that I first found this. And it turned out that Lawrence was the author of that, but I used that material extensively in my advocacy because it really showed the way in which the built environment shaped people's physical activity. So I'm not going to give away any spoilers here, and you may already get that if something's more walkable, people will walk more, but there's a lot more depth to it than that. By the way, that data from LUTAC inspired people to create something that many of you know, which is called WalkScore. And WalkScore is now tremendously popular. If you got a good WalkScore, it makes your house more valuable, and people want to know the WalkScore of places. So I'm really interested in seeing where and learning more about where the research has gone since that day. I think it's also incredibly timely. I know I'm selling something to you, and we'll get to the end and we'll talk more about it. It's incredibly timely as we look at this massive amount of infrastructure money that's being sent to places to rebuild communities and to take care of our infrastructure. And I've heard a lot of people saying, well, do people have data on where we should invest that money? Well, if anybody has the data, it's Dr. Frank. So with that, Lawrence, I'll turn it over to you and let you begin presenting. Thank you so much for joining us today.
Thank you, Mike, for your kind introduction. Am I a presenter yet? Tell me. You didn't know how to.
I think you are not a presenter, Hannah. You need to make Lawrence the presenter. There we go. You're on.
There it is. Show my screen. Awesome. Okay. Thank you, Mike. Really appreciate the introduction. I'm going to share my screen. How's that working?
You need to go to the present mode now.
There it goes.
There you go. It's perfect.
Yes. So for full disclosure, I have been a board member of America Walks for maybe almost a decade, and a strong supporter of the organization, and really appreciate your leadership at America Walks, Mike. I think we have a lot of opportunity in front of us now with the current, as you mentioned, the infrastructure bill. I'm going to go a little bit fast. I got a lot of material. I started working on this topic in 1988 when I was going to University of Washington, doing my master's and PhD there on this topic. So I'm going to talk about the history and future and why walkability, the relevance of walkability. I thought a good place to start was this call to action the Surgeon General. This was about 5 years ago, towards the end of the Biden administration. Maybe it was even 6 years ago, or even 2015. So basically, really starting by 2015, there was a lot of evidence. Most of the evidence linking the physical built environment, built and natural environment, with active travel, physical activity, obesity, and health outcomes has been associative, meaning cross-sectional, meaning we can associate A to B, that more walkable equals more physical activity. I'll show lots of evidence like that. More recently, just jumping to the kind of the punchline, we've got a lot of causal evidence now showing that when you change places, when you invest those infrastructure dollars in communities, especially those most in need, that are disadvantaged and underserved, you really get a lot of bang for the buck. That the effects can be quite significant, and causation is there. So that's good news. So basically, the goals of Step It Up campaign, urging city officials and developers to build communities that are more walkable, get away from the adverse climate impacts, GHG carbon from car dependence, which we see a lot happening actually still. And I'll get to that. COVID has had a mixed effect on our built environment, some good, some bad. And I'll talk a little bit about urban design for health. When I say UD4H, I mean urban design for health, which is my company I formed over a quarter of a century ago, which is really the application of evidence to decision making. Inside the university, we do the research, but on the ground, consulting and applying, working with end users. And I find throughout my career, like that LUTAC study that became known as Healthscape that led to WalkScore, that type of work is really where I've been able to hear the kinds of questions that are out there that need to be answered, and been able to focus directly on what people say they really need to know. And I found that very helpful. So this is in one slide, kind of the research enterprise. It contains a lot of information. I try to make it simple. So on the left, we have the things that we can influence in the built environment. The good thing about the built environment, of course, is it's modifiable. These are factors that affect our behavior and our exposures, as shown here, that affect how we respond physiologically, biologically to stimuli in the environment, which we know happens. And that affects our physical and mental wellness. That affects healthcare utilization and cost. So transportation infrastructure, where and how we spend money on transportation, and what mode, and where those dollars hit the ground in terms of community demographics, and in terms of existing communities or at the edge, that matters. Land use is really our walkability metrics that I'll be talking a lot about, really actually are mostly land use measures. Ironically, not so much transportation measures, but it's both. Investments in the pedestrian environment, critical. That's been separate historically from the walkability measures that we've been able to measure, and I'll explain a little bit why. But clearly, the pedestrian environment is very much a component of walkability. And then, of course, green space, which is separate actors. Different pots of money are used to build parks and recreational environments, and also maintain tree canopy in our urban settings, which have a very important impact on health in terms of urban heat island effect. So travel patterns, results from all of these different investments and activity patterns affects behaviors and exposures, diet, activity levels, social interaction, and then exposure to air pollution, traffic and crime, noise, affects body weight, inflammation, stress, which all interact through space and time on our physical and mental health that I mentioned earlier, and costs. That's kind of the overall way to think about it, I've found that to be a little bit good to show up front, giving talks on this topic for quite some time. So here is this hidden health cost of about over a decade ago. We were hired by American Public Health Association to investigate. By then, even 12 years ago, there was enough evidence and just intuitive. It's pretty clear that our behavior is shaped by the opportunities and choice sets that we have, and the environment in which we choose to live in, or sometimes don't have a choice, determines those choice sets and how we get around. So it was already understood that the relationships exist between transportation, investments, and land use patterns and how we get around, travel behavior, that would affect health. And we already had a good amount of evidence showing association, not so much causation by then, but that should affect costs. So we got hired to monetize using a mortality, not a morbidity, reducing the burden of chronic disease. It was more on the life mortality, monetizing life years. So here we go. This is, I started using this expression, what gets measured gets done, about in the year 2000. In 2019, we released a report through the Where Matters project for the Vancouver metropolitan region that we're still doing a new phase of. And this just shows kind of who we are. We are predisposed genetically, age and biology and disability to certain health disparity risks. Our physical environment further determines and shapes our wellness, and that affects social and cultural environment as well. We have a behavioral response, a biological response. Our risk, a relative risk for chronic diseases, are impacted by all that. And there are cumulative societal impacts that affects our overall quality of life. So we work on all these dimensions, and they're sort of like layers, and I use a pyramid as a bit of a metaphor because the foundation is kind of who we are and our physical environment in which we live. That is the foundation, and then all these other layers go on top of that. There are 3 geographic scales for oversimplification. I try to make this easy, but the regional, the transit investments versus roadway, how we get around, where we are physically located within a region, irregardless of the local environment's physical characteristics, matters. The investments made in transit really matter in terms of getting us across the region to work, or partly across the region. Walkability is actually in the middle, which is creating complete communities with destinations, live, work, play, can all happen. That is a local accessibility factor. And that's where most of the research has been. And I'll talk a lot about that. And then below that is, of course, critical that you can have the destinations, you can have the compactness, you can have a connected street grid, that route directness, you can get from A to B in a direct path, but the pedestrian environment needs to be supportive. You need good sidewalks, seating, lighting, eyes on the street, surveillance, vegetation, trees, amenities. All that really matters. And I mention this now is that the pedestrian environment is really, in the infrastructure dollars, I think will be quite helpful in this area. The cost benefit from a healthcare cost savings perspective is incredible, where you have places that have transit access and destinations, but a poor pedestrian environment, you could not have a better return in terms of investment dollars payback. So this is getting into the walkability detail. This is a graphic I've been using for over 2 decades. In Atlanta, when I was at Georgia Tech, developed this, and it's really two constructs are at play when we talk about walkability: proximity and connectivity. And there's lots of measures that go underneath each of these measures, but proximity is what's nearby. And so this just shows a community on the left that is single use, residential only, car dependent, and you have a little squiggly network buffer, which is what that person can get to on the ground within a kilometer of their home, versus the circular diagram, a circle around it, which is a crowfly buffer. So that's network to crowfly. We use those terms a lot, us wonky technical people. And then on the right, you have a community in Atlanta that has, you can see the header, this is actually near Piedmont Park, was the very beginning of using parcel data. We try to build our walkability databases off of parcel level information, so it's highly spatially resolute, very fine grained. And you can see all the different uses that are available there. So live, work, play all exists within this small area. Another way to think of, and then on connectivity on the bottom, so A to B is 2 kilometers versus 1 kilometer. Although it's 1 kilometer A to B crow fly, the network distances are quite different in these two configurations. It just shows intuitively what you might know, but the difference is amazing in terms of how somebody will choose to get around in one environment versus the other. So these are the 4 components that early on, this was about 1998, we started developing a walkability index that was working in collaboration with Jim Salas, who's been very active in this area, and Brian Salins, colleagues of mine, when we started one of the first NIH grants looking at it was called the Neighborhood Quality of Life Study. I had been working on the topic since '88, a decade earlier, but with Jim and Brian, we started putting together some more systematic metrics, and this is what these are the metrics that I proposed to them that we should measure, and was validated through that study and has been used a lot since then, with a lot of input actually from Paul Hess, who's a professor at the University of Toronto, who I was just communicating with yesterday, and we've now been building in Vancouver longitudinal. Kind of one of the things we're doing now is comparative walkability through time. That's very important because we're looking at the changes in each of these factors. So the first measure that came along actually was in the 80s. In the early 80s was actually residential density. Pushkarev and Zupan used it to justify rail investments in their treatise Urban Rail in America. Residential density was used as a basis to underpin the reasonableness of putting rail investments in many major new starts across the United States. Net residential density is very different. It's much more precise of a density measure. It actually captures the density it nets out things that aren't residential. It's a very important difference between gross and net density, where net density, the denominator, is only the land area that's in residential use. So if you can think of being in New York, right next to Central Park, and you average in Central Park, you could actually misspecify and think that somebody living in a tall building next to Central Park is in a much lower density environment than they are. So net density really matters. Land use mix came next. Land use mix is hard to measure. It requires land use data, parcel data, which is often difficult to get, difficult to use, but we do, and we've been doing that since over 34 years now, over a third of a century. Street connectivity I talked about earlier, showed an image of it. And then another measure, which is commercial floor area ratio. Now this measure, all of these measures are specified in codes and regulations. That's very important because this walkability index is completely enforceable through code and regulation. WalkScore is a very good measure of destinations, but you cannot regulate there shall be 5 restaurants on the corner within 5 minutes of your home. You need to regulate the land use decisions that lead to and make that viable, along with the incentives sometimes in certain places. So commercial floor area ratio gives you a measure of having the building up to the curb and it being in a very walkable format rather than it's proxying for parking, surface parking, or lack thereof. Lack thereof is more walkable. So the other things that are missing are sidewalk completeness, pedestrian environment factors I mentioned earlier, and I mentioned those features, and then other factors that are impacting eyes on the street. That's building design, windows, having a lot of other design characteristics. So these walkability components vary a lot. Here they are in Vancouver. This is fairly recent data. We've got 3 or 4 time points we've been measuring walkability, as I mentioned, in Vancouver, and now we're really measuring change in walkability. That's what we do now. So here's commercial floor area ratio. You can see the variation in that across the region, intersection density, net residential density, and here I have sidewalk continuity rather than land use mix. So sidewalk continuity is becoming available. We're now building databases where we know where sidewalks are and aren't. extremely important for programming dollars where you put the next piece on the ground. So the built environment, features of the built environment therefore include transportation network, land use, and design characteristics. In the interest of time, I'm going to move ahead quickly for a bit, and I can come back to some of these later if there are questions. So applying this, we call it a utilitarian walkability index because it predicts travel to destinations, whereas recreational walkability might include parks and green space and walking for non-utilitarian purposes. So this is the composite index I just mentioned. It just shows it in Portland. We've done it in, I don't know, 20, 30 regions at the detail level. Also to mention is that we build the smart location database for the Environmental Protection Agency, the US EPA, and we also translate that into the National Environment Database that we're going to be launching and releasing at this year or later this year or pretty soon, that has built natural and social environment measures, a lot of them for the entire country. And we'll be rolling that out to help support research and policy work in this area. And through the support of Robert Wood Johnson Foundation, this work is used to measure the Robert Wood Johnson Foundation's Culture of Health walkability metric. So I'm going to talk a little bit about how these measures have evolved through time. On the left, you see the fixed neighborhood. This is a census unit. This is a block group. That is all. When I did my dissertation in 1988, when the first walkability study was done, studies were done, I will mention, actually, there were two other researchers at the time that were looking at similar things. One was Susan Handy, and the other was Ruth Steiner, that were at Berkeley. And so we were the only people looking at this. I don't know what kind of data they all had. I was able to get, actually in 1988, there was a guy named Mike Quinn who was at King County, and he had made it possible, he had flagged for every parcel in King County what census tract it was in. So we were able to aggregate and measure mixed use, or the evenness of distribution of floor space three-dimensionally. So buildings have many floors. We were able to develop a three-dimensional walkability index in 1988 because he had done that. There was no GIS. There was nothing called GIS. We didn't have any of those software tools at all. So much later, this is sort of the 15-minute buffer. This is a way to simulate a 15-minute person parcel access buffer. This is really cool. I like this. This is a echo buffer. These little triangles are transit stations. So if you get on the train, person lives in this, with this, I guess, pentagon-shaped thing is located, the orange. But these are the train stations. So someone living here in 15 minutes from their home can get all of these shaded areas, because if they get on the train, they're going to consume a little bit of that 15 minutes, and each further train they away is less, just like an echo, or like if you cast a pebble across a calm body of water. So now we're thinking about daily activity space, so home, work, and play. Our behavior shed, or the areas, our activity spaces, of course, aren't just where we live. So if you want to understand someone's food purchasing behavior, you need to look at what's on the right. So obviously the levels of complexity in which this happens, I'm skipping by a whole lot. Like the way the buffers are constructed now with GIS, where we capture only the areas along the road network, only the parcels that are accessible. This level of detail just was completely impossible previously, and that's simulating the actual experience someone has as they move through the environment. So the catchment area combines transit access and walking, access to Eric Fox, who works at Urban Design for Health, who helped pull a lot of this information together, has been leading the development, a lot of these databases for a very long time, very talented. So access to transit mode and measures of non-contiguous access. So this is really, this was part of his master's thesis that he did using Seattle data while studying at the University of British Columbia with me. So these buffering techniques have evolved over time. Too much information for now, but I can come back to it. One of the things that's critical when we measure a walkable network is we need to eliminate the parts of the transportation network that are not walkable. If we measure connectivity and include freeways that have no place to walk, we would really misspecify and mischaracterize what is walkable and what is not. That's what this slide shows. Regional accessibility. Well, this is picking up, and that's why I came up with the name Where Matters, because this is all about where, not how a place is designed, but again, where you're located, that top level in those three regional accessibilities, that macro regional kind of where you are. And this is sort of picking up wherever you are. You have travel times. Many of us are using our phones, most of us now, when we get off a train, arrive in a new city, get at the airport. How are we going to get somewhere? We have all the travel time. The transit access time is now provided for most locations. The general GTSF, General Transit System Feed Data, I think it's called, and it's very useful. So here we go with the WalkScore. Mike, you mentioned it. Research leading to WalkScore. We actually helped WalkScore twice. First, we published the walkability map from that LUTAC study that became known as Healthscape, that Ron Sims, King County executive, initiated. And that research led to a publication that Eric Prine put in the Seattle Times, a map. I got a call from Matt Lerner, who saw the map in the newspaper and was with Microsoft. And he developed the first version of WalkScore, as you said, around the year 2000, formed Front Seat, which was the company that later got bought, that he sold to Redfin. We then partnered again because the first version of WalkScore had Crowfly, airline distances to destinations, where you would see people walking that showed a map or the destinations across water. And I always said that so far I've only heard of one person who can walk across water. So not enough of us can do that. So we actually went back to the drawing board. Robert Wood Johnson Foundation, it was Tracy Orleans initiated, who was really the godmother. She's the one who spawned and started active living research that funded so many studies over the next between 2002 and 2012 or 2015 was pumping out research and supporting this whole area, as many know. So we partnered with Front Seat and we led the development of the research that created the Street Smart WalkScore, which is a network-based WalkScore measure. Published finally, a decade later, I finally got the paper published on that work, noted down here if you're interested. But in the bottom line of all this is that destinations matter, but again, we also need code-based tool for policy development. And this work helped to establish that we did, I believe, what are the algorithms in WalkScore. So here we go. This is quintiling. So walkability, and I've talked about it. Here's an array of walking. This is a transect, kind of thinking about Andreas Dewani, DPZ, sort of from the edge to the middle, but measured empirically. So car dependent, adding up all these features. And I use this in Vancouver in the Where Matters collaboration, funded by many agencies there, the Metro Vancouver, but the Ministry of Transportation and Infrastructure, Real Estate Foundation, the City of Vancouver, City of North Vancouver, all working together collaboratively on TransLink to have an opportunity to influence the policies and understand how health is impacted. So these 5 levels of walkability are going to be reflected in the next several slides in their association with a variety of health outcomes. Well, starting with physical activity, so you can see relative to being in a car-dependent environment, and what this shows is that you don't really need to go all the way to the, most extreme level of walkability to see a statistically significant difference. Where I have darkened arrows means that these results are statistically significantly different than car dependent. So you can read the text below, but you can just look at the arrows. It's pretty easy to understand. These are the quintiles from the least to the most walkable, and at the extreme, 45% people are 45% more likely compared to those living in a car dependent area to get the required recommended amount of walking, which is at least physical activity, 30 minutes per day. Then we move down the causal pathway to obesity, and we see only at the most extreme, but wow, what a difference. So that's a non-linear relationship, but people living in walkable areas are 42% less likely to be obese compared to those in the most car dependent. It's an enormous difference, but only at the extreme we saw there. But let me get to diabetes. Further downstream, 27 and 39% reduction respective to the most car dependent. Walkability and heart disease, we see a significant difference at the margin. And then we see walkability. So mental health is becoming obviously more and more understood to be related with the environment. COVID certainly taught us that by being home a lot over the last couple of years, is that the environment where we live not only affects our physical health, but our mental health, having places to recreate and all the rest, physical activity and so forth. So we've been studying that. And here's some amazing results, which we're writing up now on the mental health impacts of walkability in Vancouver with very large sample sizes of 2 different independent data sets. So very fortunate to have Vancouver Coastal Health Authority and Fraser Health provide that data to us. So car dependent, compared to the most car dependent walkability and stress, you can see the results there, obviously significant differences, even in very modest. So car dependence comes with stress from time spent in cars, which I showed in 2004 in Atlanta to be a significant predictor of obesity. Each hour in a car was a 6% increase in the likelihood of obesity, but there was also a stress effect that has been measured and reported and published by others. Sense of community, all in the expected direction, all of these results. So I thought that these slides might be an easy way to communicate. They were set up to be graphic and easy to understand. So sense of community, we've been publishing and doing research on that for quite some time, is definitely related with the physical environment where we live. So now, where to from here? So walkability is not evenly, the benefits of walkability are not evenly borne by the haves and the have-nots. Walkable for whom? So cofactors that come with walkability differ significantly by demographic group. Wealthier have green space, shops, entertainment, and other destinations, where the poor have air pollution, noise, crime, and injury risk, and none of the benefits. So you kind of have all the good stuff attached to walkability if you're fortunate, and all the bad stuff that's attached to walkability if you're not. So what we're seeing, and this was actually pointed out by Rand Corporation, who works with Robert Wood Johnson on the culture of health, is that walkability does not itself predict better health outcomes for the underserved due to these cofactors. So we are now working on that topic extensively and identifying what is a socially just metric of walkability. And the truth is it's more complex. Here we go. So this is using Seattle as a test case. So you can see a thematic map on the left of people of color and low income, and that spatial distribution, which we see reflected in the following several factors. Tree canopy or lack thereof. Now, this has been proven and shown many places. I know in Baltimore, I think Johns Hopkins is doing research on this, and others, is that a tree canopy covers the percentage of block group with tree canopy. The USGS, I know the US EPA, we use their data a lot from EnviroAtlas and EnviroScreen. There's excellent data on tree canopy for most of the country. You can track this and look at how it differs relative to demographic group. Proximity to loud noise, obviously very tightly bound to roadway. And as you would expect with injury risk and exposure to and air pollution exposure as well. I don't know that I have a map of that here, but air pollution exposure, of course, is very closely aligned with the road network. In fact, I will mention, because I do not have a slide of it, I think around 2007, working with some other colleagues, we correlated in Vancouver walkability with exposure to air pollution using nitric oxide, NO, as a marker for particulates. The correlation between walkability and air pollution exposure is like 0.6. It's extremely high. So there's a lot of worry there. And that's what this is showing, is that wealthier people don't live right, and the distance decay is very quick. 2 blocks away from the main roads with all the air pollution, the air is much better, especially particulates. So we've created a composite measure of all of these factors, and we're layering that into walkability now, and we're learning a lot from doing that. Population living in the US is block groups with the worst environmental exposure. You can see about 15% people of color, more than double compared to about 6% white, and then 12% low income compared to about 8% high income. So you can see this is just showing the demographic distribution. Lindsay Braun is a colleague, a professor at University of Illinois Champaign-Urbana, is working with us, and her focus with us is walkability healthy and accessible for all, is really on this social justice topic. And she's doing some excellent work. She presented last fall at a conference, and we're now writing that up. We're using the two different waves of the walkability index that we built for the with the smart location database and other factors that we have nationally available. So there's 2 time points, and we're tracking how changes in walkability relates with demographic differences. So I'm going to move towards wrapping up and talk a little bit just about complete streets and supportive environments. This is a study that we've done in Vancouver, where we've been publishing a lot from. The city of Vancouver funded us to do an evaluation of their first greenway in the city center. This was a pilot that led to, from the results that we had, I went and presented at City Council, led to their approval of a citywide greenway plan that they've been implementing, the Arbutus Greenway and many other greenways throughout the city. This first study came off really well. We were very fortunate to be working with Mustel Group, who did the data collection and did a fantastic job. Jamie Kell led that work. So here we are looking at our sample of people living near the Comox corridor versus those living further away, our cases and controls. So we had excellent, but here it is beforehand. Something happened to my word before. But anyways, you can see pretty walkable to begin with, but when you reappropriate the road space, which is now being considered and done in many cities across North America because of COVID, people are actually willing to let some of the space on their roads be converted so they can walk and bike. You see significant differences. We've had 3 papers showing really significant causal effects, positive of much more physical activity, adherence, and biking, and less GHG emissions. So monetization is a key factor. I know I need to wrap up, so I'm just going to mention a couple things quickly. I'm going to jump ahead, but we can monetize the health impacts of transit-oriented development and transit investments, of course, because when you characterize the environment and measure physical activity and predict health impacts, and you see those like arrows showing on those results I had, that less chronic disease means less cost of healthcare. Of course, it saves money, but it does other things. There's a lot more to the story. And I don't have time to go into it all, but I'm happy to share more information. In a study we did for the Southern California Association of Governments in 2016, we saw an $8.41 payback for every dollar spent on active transportation infrastructure by not only monetizing the healthcare cost savings, but by incorporating the workforce productivity benefits that come from a healthier workforce. So last thing I'm going to say is that all this evidence doesn't do as good as it can if we can apply it. So about 12 years ago, we started building software tools to do that. We have now rolled out, the EPA has been funding us for a long time, very thankful to Alan Brooks at EPA for doing so, developed this model, and it's been applied in many places across the country. It basically uses social environment metrics, built environment metrics, and predicts a range of health outcomes as shown in this graph. More detail here than I can mention by words, but lots of outputs you can see, and we're building more and more outputs all the time, things that we can predict, and the inputs are much more complicated than you would see here. These are all indices. So these are all factors that are loaded into the model because we have all the data sets that we've been building for quite some time, and we've been applying this model in many places. Los Angeles, Houston, Rochester, Las Vegas, Chicago, and many others. We have more case studies coming online as well right now. And we're able to predict body mass index. These are more of our application sites. There's a whole workflow and that allows, so this will allow a test to be done on alternative ways that communities, corridors, regions develop. I think regional planning has been one of the main themes, but community level, we've been publishing a good bit on the studies we've done at the neighborhood level. This is just showing in DC a thematic map predicting, I think this is estimated healthcare costs from type 2 diabetes. This is diabetes prevalence in Chicago. These are all census block group geography maps. My last slide. So now we need to be thinking about, obviously, the digital divide, not only the walkability divide. And we know that having access to internet and other things matter as well. So we talk a lot about walkability, but we need to be thinking more contextually when we talk about social justice and think about what is a more equitable way to invest some of these infrastructure dollars that are coming available. Thank you. So I turn it back over to you.
I'm here. It took me a second to make all the clicks work.
I was
and
hoping.
I'm joined by Hannah, and I'm also going to be joined as soon as Greg figures it out by Greg now, who is the chair of AmericaWalk's chair of our board, and also, works at Change Lab Solutions in this general topic area too. And Hannah's paying attention to all your questions. We'll turn to her in a second, but there's so much here to respond to or even start talking about. Greg, do you have an initial reaction and thoughts as you looked at that information?
Well, I just want to say thanks, Lawrence. This is really impressive information and really great to be able to aggregate all of this different data together and try to come up with a really holistic and comprehensive understanding of what it means to live in a livable community and how to balance the health impacts of walkability with the risk exposures that really affect so many different aspects and communities within our country. What I wanted to sort of just ask, Lawrence, to you is just, given all of this, bevy of data that's been sort of collected, I'm curious if you've, in your experience, figured out or heard what's been the most influential aspect of this data for policymakers who are listening to it or who are, reviewing it within the individual city plans or city analyses that you've run.
Good question, Greg. Actually, I'm compelled to answer. I was recently given the opportunity to present to the regional planning in Las Vegas, the Regional Transportation RTC Council and Commission, and I was told afterwards that even now elected officials, because of COVID, are dealing with so much pressure that is health related that even just the connection with health to show that they have, through investments in more complete communities, dealing with tree canopy, things in that region that are critical, the ability to deal more structurally with the physical environment gives them a way to respond to constituents and that they need. So I think of all the times in the past, this is now maybe the best time where the receptivity is so great that even clear communication that there is a strong connection between the physical environment and how you invest in transportation and people's health, that I think just sort of the most basic level, but actually the ability to do something with the data to show contrasting ways communities can be built in the future that we now can simulate with reasonable confidence of what the health impacts will be of alternative investments, that those future scenarios and working with communities to develop these scenarios and understanding that density is not the enemy. Everybody's trying to deal with that issue.
There's a couple of things that jumped out at me when I looked at this. One was the fact that being co-located with a busy arterial has such significant negative health effects. And speaking from experience in city politics and neighborhood politics, we often hear, well, put the apartment buildings on the arterial as a buffer to preserve the single family areas. And you'll see planning oftentimes works that way, right? That the density can go next to the busy road, and we preserve other places. And what really jumped out at me was the really, the race and class discrimination aspects of doing that. Like that, it's yes, it's natural for apartment buildings to be closer to bus stops or transit stops, and that's kind of a natural pattern. But it's an unnatural pattern when it's enforced or driven into those spaces and not allowed to distribute through the neighborhoods, like you might see in a neighborhood that was built before zoning before really tight zoning strictures occurred, right? In very old neighborhoods, you see a real mix of uses throughout the neighborhoods, and you don't see that stark division. So that's one thing that jumped out at me that people can do right now, right? You don't have to put all the density on the arterial.
That's
And
good point. Really good.
well, it's just to add on to that, Mike, I think it helps uplift that this data is not just useful from a transportation planning and transportation equity standpoint, but from a housing perspective as well. So when we talk about how are we zoning our communities and how are we developing them, but also what are the building codes that we're putting into place for housing that is going to have a higher exposure. So I know there's some examples, for instance, in San Francisco and Boston, where they started experimenting with calculating what the environmental air pollution exposures are of being near busy arterials, and then updating the code for new complexes that are going in there to make sure that they have appropriate HEPA filtration, and we're not going to see some of that exterior to interior air pollution process exacerbate the health disparities that we see within some of those communities.
Yeah, so there's mitigate and there's prevent. Okay, I got one more, and then we'll turn to Hannah to share some group questions. And one of the things is that the rigor of this approach enables you to make predictions as to the health effects of different transportation and land use regimes and the costs associated with it. And as somebody who's been involved in a lot of EIS analyses and cost benefit analyses of roadway projects, the primary method that's used for this to evaluate the benefit is how much time have people have saved, because allegedly will have saved due to a bigger highway or a wider roadway. And I think what you're telling me is that a bigger highway and a wider roadway actually has really significant health costs for people. And it's just right there: diabetes, hypertension, et cetera. So stress. So which is bigger, Lawrence? Can we measure that?
I think we can. Actually, what's fascinating, the tools that are used for those analyses that show that, delay and congestion has this huge adverse economic effect, those tools are actually the same tool that we use to show the health benefits, because workforce productivity is so heavily weighted in the tools, the cost benefit tools used to justify road expansion. But those same metrics work really well when you want to monetize the health benefits of workforce productivity, a healthier workforce and a more productive workforce. So it actually worked in our favor. AECOM actually ran the model that I showed you, the $8.41 return on investment for LA. And I think we should talk more about that and learn more from that one case study and find ways to apply those tools more holistically, because I think you're right. I think that this, which is more, I think it's, obviously everything is so context specific, but I think the health benefits are greater. It just depends over what period of time, because they're cumulative over time. Once you build the infrastructure, you get the health benefit ongoing, but when you build infrastructure that's car dependent, you're accumulating adverse health impacts over time as well. I don't know.
Okay, so all you freeway removal folks, you've got some data here to dig into. Hannah, what are we hearing from the audience? What are the questions they'd like? Where do you see some stuff there?
We have a lot. We always get a lot of questions, so thank you all for being so engaged. And again, we're gonna try and use some of your questions too as a jumping off point for a blog post that we'll be putting up a little bit later. So for right now, I think the one question that we got that I really liked, and there were several sort of iterations of this, which is that like walkable cities, like they're better for public health, they are better for climate, but they're also safer for children and elders and families. So like, how do we get the word out that walkability is about these large issues like climate, but it's also about families and the people who live in those neighborhoods and need to get around?
So that's a question that Mike can answer. I think Mike can be why don't you start answering that one first, Mike? I think you're
Thank you for coming to this webinar. Thank you for joining our mailing list. Thank you for being a donor to America Walks. This is like the biggest question we have. It's a movement and you're all part of it. But with that, I actually really loved Greg's question too about what has Lawrence found to be most effective in speaking to decision makers. And actually, I'd love to hear from folks at the local level too, you know, what you found. I would love to hear your own case studies of what you found flipped a local elected official from skeptical to supportive or from opposed to neutral. I'd love to hear what messages worked for you. We're all in search of how do we get the word out more effectively. And we've got 1,000 plus focus groups out there with all of the work that people are doing at the local level. Lawrence?
I kind of think back on what we did in Atlanta when we had this Smart Track project that was one of the first studies where we had a lot of data. And in Atlanta, such a car-dependent place, and we identified the barriers for developers, barriers for the funders, the financial community, and for the elected officials, and each listen to each of them identify what the barriers were, and by targeting the barriers and and providing evidence that is focused on the barriers, that kind of helped make it more focused. Of course, they all pointed to each other as the barrier. So the developer said, "Well, I can't get the money," and the lender said, "Well, I think let's not forget about the lending institutions and the criteria for giving money and what gets built and what doesn't." That's a big part of this. But I would say one of the key things is, and I'll go back to, and I'm in San Diego now, so you have to, Vancouver, it wasn't as big of a deal. But density is just, you can't do anything if you can't build any compactness, because there's no one. The shops and services and the mixed use won't happen if you don't have people living nearby. So, I just think that we have to really focus on educating people that how to make density work and not be so resistant to density. I personally still think that's, as sad as it is that it's still an issue. It really is.
What do you got,
just
Nick?
to hop in?
Oh, hop in, Greg. Hop in, Greg.
I was just going to say the last thing I wanted to add is that, in doing this convincing, we have to know that we're talking to audiences at all different levels. And I think that the data that Lawrence has pulled together and talking about population level health metrics is really important for making, for influencing overall decisions. But I also want to elevate local voice and local testimony and showing up and providing examples and stories of how people are experiencing their community and walking around. And I just don't want us to undersell your individual ability to really influence policymakers and decision makers and make that case about how personal of an issue this is for children, for families, for your grandparents. And so I just wanted to uplift that before we move on.
Well, that's really critical, and I will say that that's why we're writing up the case studies of the end users, the people that are actually using the research and what they're being able to do with it, because the research itself is useless. It's people's story, it's their experience, and what the research does is it underpins what someone, it identifies how to act and gives ammunition for NGOs. So it's those stories of the people that are actually on the front line that are actually really making the difference. And that's why we're writing up the case studies of the end users. And I think, and when we talked about doing this webinar, we actually discussed the possibility of having end users involved right there at the front end, but there's not enough time for it to do everything. So that might be a follow-on, is let's hear from people that are actually making use of evidence and decision-making and what their successes and failures are and how to benefit from that.
We are almost at the hour, and I know people drop off, but I also know that we go over a few extra minutes. So I'll put in a couple of closing thoughts that aren't really a closing, and then we'll answer a couple more questions, just so I don't lose everybody. americawalks.org/donate. We really do count on you. Your support really matters to us. We actually have a lot of material on our website too about effective communications, and we did a webinar with some great communicators. So evidence is a part of that though, and data is a starting point for all of this as well. And my final point is the relevance of walkability, the relevance of land use to walkability has been something that's been apparent to me for years, and I think to a lot of the members of our board. And And we intend as an organization to enter more into that discussion and highlight that more as we move forward, particularly as so many people are priced out of living in good places, and particularly as, demographic populations, whether Black communities or immigrant refugee communities, are being forced into unwalkable places because we will not accept the idea as a nation that we need to build more housing in the places that already have shops and stores and walkability and transit. And this is a really major issue of trying to give those types of quality of life outcomes to everyone. So consider this, those that are still here. I see several hundred of you still here. This is just us kind of putting a little bit of a marker in this space, and that we intend to work more on it in addition to things like physical infrastructure and mobility justice issues that support walking. Hannah, more questions? We'll go a couple more.
Oh, we have a couple more. So here's another one that I thought was sort of like this is sort of more of a data specific question, but was the impact of like youth population taken into consideration in all of this sort of like use of plat maps and stuff, and like how, because there is like a lot of movement and transient like younger populations, whether it's for college or just younger people who move around a lot, like how is that taken into account in this research?
Quite a bit. It's a good question. A lot of the studies that we've done and others have done focus on different age groups. We have a whole number of NIH grants, major studies focusing on teens, focusing on kids, elderly. We've studied elderly quite a bit. In fact, elderly and youth are the indicator of a walkable place. So we're very focused on that. And more sensitive, especially that I talked about the pedestrian environment investments. For a senior, if there's no seating or the crossing is not, really well done and fast and easy and safe, they won't walk. So we're been very focused on, but you have to do those studies in a population specific way. So you have to isolate and really just, target. And there's even a global study on adolescent that's underway that's huge, and we've been working on for quite some time. So there's if someone's interested, can send a question, and I'd be happy to connect them with lots of research and findings just focused on youth and elderly.
Okay, here is one more. So given the WalkScore is dependent on destinations and land use, how do we pivot to make WalkScore more focused on the pedestrian experience? And how can you quantify some of those different aspects of walkability, some of the ones you talked about, like, windows and storefronts and that kind of thing?
Well, we're doing that and adding that into our research and our, data set. So I think we've given enough to WalkScore. 2 times. So happy that I would say they're there and that worked out. I don't think a third donation is needed. So, that's being using Google Street View imagery, artificial intelligence, or basically distilling microscale features of the pedestrian environment, and we've been correlating and using those as predictors of behavior and health outcomes. So that's being built into the walkability indices that we're doing, and we're actually building tools that will take into account microscale features. So the public health assessment model that I showed you that's being used around the country in the future will have seating and lighting and those features in them. So Google Street View provides electronic images for the whole country and elsewhere around the world, and several researchers are distilling out of those images all those features of the microscale pedestrian environment.
Wouldn't that be an amazing feature on Google Maps if it could show you, because I know when I choose a route, the lower stress route, the more pleasant route, even if it's a little longer, I will choose it on my trips. I also know that on my walking trips, there were places that maybe as close as somewhere else, but a hostile, something hostile in between. Boy, could you imagine if Google Maps could show low stress versus high stress streets for walking and biking? That would be an amazing feature. Yeah, okay, Hannah, more questions.
Okay, so I think this is interesting, and maybe it's slightly off topic, but I think it's worth talking about. So given environmental barriers, I wonder if this person is perhaps in the Pacific Northwest. Is there any sort of like working with or partnership with other forms of transportation that could connect walkers over environmental barriers. So thinking like micro ferries, water taxis, that sort of thing. Like have you ever looked into how to bridge physical barriers that, like you said, you can't walk over water, so how do you get over it?
Okay. Well, actually, the most clear connection that a lot of us think about in our daily lives is that active transportation and transit are synergistic and are one solution, really, an integrated solution. So cycle, bikes on train, being able to cycle to the train and put your bike on the train, those kinds of things, that gets you the most competitive travel time difference of anything. So making transit more effective by reaching more people, by having a bigger reach. So that's a critical thing. Now, getting across water, integrating active transportation and the ability to move across water. Actually, there are good examples of that in Vancouver. The C-Bus, there's a lot of integration. Modal integration, of many modes is obviously critically important. But the water barrier piece is a bit of a very specific kind of a question, and how to do that best. You probably cost benefit. I would say bike sharing is a better solution than making boats huge so you can put a ton of bikes on the boat. That doesn't make sense.
All right, do you want one more?
Keep it rolling. We still have a fair number of people. So your interest is what's keeping these questions going, audience.
Okay.
So in Tacoma, Washington in 2020, a child was hit by a car on the way to school once every 8 days, but it was much more frequently in neighborhoods of color. So as walkability as a concept can be used in similar ways as livability within our social strata to increase home prices and values in various neighborhoods, how have your research methods looked into and then sort of led to supporting access to walkability and bikeability in poor neighborhoods with that may not have access to other resources, and thus how do you take into account the role of walkability and a higher WalkScore within gentrification?
Complex question. So I'll answer it the best, and I hope Greg and Mike add to what I'll just start off and say a few words. I think the injury risk, the crash rate, and the demographic information, the obviously more underserved, poor minority communities, we need to be prioritizing those places for investments to make it safer to walk, to make it possible, and then of course safer. And when as you think about where to land the dollars on the ground, obviously with all those data layers that I show you, we have that helps. That's part of it, but that's only part of it. And I'm sure Greg would agree that's that's just the beginning of the story, or a good part of it. But I think we should be using obviously crash rate information or predicted injury risk, and not just injury. We need to deal with the social environment, which is the crime and risk of or fear of crime. So it's not just injury, but also from anyways, I think that those two factors matter and need to be built into the prioritization. And I think that's important work for America Walks, is to come up with ways to prioritize where you're going to get the most benefit. And it shouldn't just be cost benefit. That will actually probably align because the rate of injury is so great. But I think there's other pieces to that is socially important.
Greg, I'd love to hear a few words, Greg, as our chair. You're muted.
Still muted.
Still muted. You kind of have to click twice to get there.
Is that better?
That's better, thanks.
Apologies. As I was saying, folks, that this is definitely a question that we at America Walks are spending a lot of time thinking about. Anytime we talk about infrastructure spending, the potential for gentrification and displacement effects exists. And we know that there's a history of communities being reluctant to embrace potential changes and investment because of the fear around displacement and effects. impact. And so, you know, as Mike talked a little bit about the us sort of taking into account and venturing into land use a little bit and understanding community development broader, you know, I think that that's what we're trying to do here, is to make sure that, you know, decision-making processes about spending are use a cost benefit, or use some prioritization process that will hit the best you know, health savings and best benefit for the community, but do so in a way that it's led by the community in a sort of a participatory manner, where the community is asking for and embracing the investment that's happening, and is paired with other types of protective policies that can help address some of those displacement and gentrification fears. So, you know, that's why having strong housing policy is really important, to make sure that we're, you know, not going to have massive tenant displacement and things of that nature. So that's sort of where I was going to go with that, Mike.
Yeah, and I would add a little to this too, which is that you know, that our transportation investments and land use patterns impose a really high cost on certain communities in terms of deaths and serious injuries for the benefit of other communities that are driving, that are safer, but those, you know, so basically the arterial through a neighborhood with fewer resources. And it was my experience, you know, in watching this at a city level, was, you know, there were some neighborhoods that wouldn't stand to have those streets in their own neighborhoods, but they would actively advocate for a wide street through a black or brown neighborhood because that was their commute route. So there's a lot, we really put a lot of burdens, and it's totally related to, you know, who's better off and who has power and who does not have power in a community, or in a city, or, you know, even with regional or state level decisions that are made on new transportation infrastructure. So, you know, what we know is most of the pedestrian deaths are on high-speed, multi-lane arterials, and that describes a lot of streets through poorer neighborhoods. And I was talking earlier about you know, I think we've talked about, the phrase has been the suburbanization of poverty. You know, we have really seen that as urban areas have become more popular, but their zoning is locked down, the more affordable places to live are further out. And those are oftentimes in places that are built heavily with those high-speed, multi-lane arterials with few crossings, you know, and those are the places that need to be fixed, you know, if we're really going to save lives, and where we should be giving a higher priority. So when you look at all the data as to, you know, who's dying, who's being injured, who's breathing bad air, and we know, as Greg points out, one of the things we like to do is we like to support, we are here to support local advocacy. So if there's a group working in that community saying, we want this street to save more lives, we're there for them, you know, to work with them. And I think the flip side of the gentrification debate is that the neighborhoods that are safe and leafy and green and have lots of destinations nearby and have good schools really should allow more people to live in them. And I know that that is viewed as a controversial topic, but it shouldn't be a controversial topic when so many of our neighbors and you know, fellow residents are desperate to live in such places that are cheaper, healthier, have access to good services, and have access to schools. And I don't know, I'm getting on the stump here, a danger of a former mayor, but really, America, get over it. A corner store, a small apartment building, a backyard cottage, some townhouses. Look at that wonderful image that Lawrence gave of the different scales of walkability. Those are great places to live. We should allow more people to live in those places and not be pushing people to these dangerous, polluted places to live. It's a choice that we can make and every local government can make. And we're there for that, to give more people that opportunity to do that. I look at a campaign I really love. I hope we get them on here in the future, Desegregate Connecticut, really working to break up the types of zoning that prohibit people from living in kind of those high quality of life communities that should be available to everybody. That's almost a close. I think that's a close, folks. 3:12, we still got a bunch of people, but we went a little over, and I think I closed there. So Lawrence, thank you so much. There's so much data there. Hannah is going to come in and try to answer all of your questions. There'll be a video up. We'll get a blog post up on it. This is actually a launching point for a lot more. Greg is our took on the board chair responsibility this year. We have a great board. Learn more about us at americawalks.org. Get engaged, and we're here to work with you to make better communities. And again, thank you to all of our supporters and sponsors, and particularly the Centers of Disease Control and their Active People Healthy Nation program. Thanks, everyone.
Follow us on Instagram. It's at
Follow
America
us on
Walks.
Instagram and Twitter. Yes, absolutely. Thank you all.
Bye.